Tourniquet conversion. We're going to talk about that today and when we use it, what it is, and how to do it. So, tourniquet conversion, in essence, is converting a tourniquet, whether because it's been on for the 2-hour mark, or maybe it's not the ideal treatment anymore and you want to downgrade to something that's less invasive, like a pressure dressing or wound packing. So the scenario here is, imagine you're a couple hours away from any type of advanced medical help, a hospital or a trauma center. EMS is going to be a while to get to you. Maybe you're sitting in a campsite, your friend has an accident or negligent, discharge at the campsite, shoots himself in the hand. The bleeding itself is arterial bleeding. So just to cover that, the difference between arterial bleeding and venous bleeding, if you, I don't want to get this too dirty here, but if you envision arterial bleeding would be where it's actually squirting like that with the pulse of the person, right? When you see that, that's a good indication that it's arterial bleeding, right? Person has, a few minutes, you can lose all your blood like that. If you see bleeding that's like this, then this could still be arterial bleeding. It's just that maybe it's being covered by tissue and so forth, unless it's just a straight open hole like this. But you'll be seeing maybe venous bleeding where it's just slowly pulling out. Both need to be addressed, and both of these injuries, the bleeding needs to be stopped. Okay, so what do? A few options, and I saw that we posted this question as a pop quiz. Some of you guys said, I'll do pressure dressing. Some said, I'll do wound packing right away. The concept here is time is of the essence. The longer you wait to stop this arterial bleeding, the faster this person could die or go into shock, losing enough blood. So the most simple thing to do is actually, well, imagine that the heart is this way. So this is the shoulder, this is, let's just say, the hand. You're going to do direct pressure above the wound, actually, in a circumferential manner to basically kind of create a semi-tourniquet, an improvised tourniquet, by pressing around it. You can also press, let's say this was this hand, in the brachial area, push down. You can use a fist, you can use a knee, but you're pushing down. You can even use your thumbs to compress that brachial artery into that bone. You're trying to slow this bleeding down. In the meantime, we have people calling for help. If this was a gunshot wound, we want to make sure no one's picking the gun now. We want to make sure that's safe. And now we're bringing the trauma kit. So someone brings your trauma kit. Instead of messing around with all these other things, this was an arterial bleed. Time is of the essence. I'm going to grab straight a tourniquet. If I can go around the wound, so this case I have a bottle here, so I can't. We'll pretend I can go around, or this is why it's important to learn how to disconnect these, the buckle. So I'm going to go straight around it. I'm going to go on, so if this was my left hand, on the forearm. There's no need to go high and tight here, because the more success of occlusion is with less tissue, as you see here, and the 2-bone issue has been ruled to be false. So we want to have the most success by occluding this, by going low on the extremity, a couple inches above the wound. So in this case, I will now put the tourniquet on. I'll go ahead and turn it until the bleeding stops. So in this case, with the SAM, it's nice because you don't have to turn it much because it takes out all the slack. I would have taken all the strap through this buckle or the retention clip and then secure it. I can write the time. Now what this has afforded me is I can breathe. I can now adjust my thinking, see how he's doing, calm him down, and I want to look for other wounds, because this bullet that maybe was in his hand could have traveled out the forearm here, could have gone up his arm. We want to be able to look real quick, make sure maybe it's in his leg, and this is a distracting injury. So it's very important to now breathe and take a look. This is where we start talking about tourniquet conversion. So is this the ideal treatment for this specific wound that's to the hand? Some will say yes, some will say no. I think it is for this appropriate time of the injury. Why? Because this has now afforded us to, again, do a secondary assessment and get some other equipment before I go and pack this wound. So now we have to start thinking about getting him out of this area, right? Going towards EMS. So we called EMS, maybe a helicopter's en route. We're going to put him in a vehicle. We're going to start moving. You have 2 hours before any nerve damage occurs with a tourniquet. So let's just kind of fast forward in time now. I decided that I want to wound pack this. It's no longer bleeding, but we're getting to that 2-hour mark, right? So what I want to do is plan for that. So I'm going to have my gloves. I'm going to put those on. Those will be in most trauma kits will have gloves. If they don't, that should be a red flag. initially, as you saw, I didn't use gloves for the tourniquet because I can manage to, put a tourniquet on real quick, and if I do get some blood on me, I can clean it off, but the goal is to stop the bleeding. So now I have my gloves on. I'm going to prep my equipment. So I'm going to use QuikClot to pack it, and then I can cover that because it needs to have direct pressure on it with a SWAT tee. I can use a pressure dressing and so forth. So now what I want to do, again, the tourniquet is still on. I'm going to grab my QuikClot. I'm going to talk to the patient, explain what I'm doing. I'm going to make a little ball here, and I'm going to pack the wound. I'm not going to feel it pulsating like a typical wound because there is no blood flowing. So I'm going to fill this cavity by putting as much of this material in here and making sure all the sides of this cavity are filled. So I'm going to go to the top left. I'm going to go to the top right. I'm going to go to the bottom right. I'm going to go to the bottom left. And I'm going to continue to fill this in all the corners of this cavity to create pressure as if this was a brand new bleed and it's literally squirting blood out. I'm really packing this tight and making sure that there's no more room to put any more material. So I can't go anymore. I'm going to put this on top. Now I can open up my pressure dressing here. Okay, other side to wound, as you see it says. So I'm going to now put that over this. And I'm going to wrap this, pretty tight because I want to keep a lot of pressure on this wound. So I'm going to keep wrapping it. All right, so now my hand here is going to be a hand here. I'm going to look at the cap refill. That's when you press on the fingers. I'm going to see that there's no circulation because I have a tourniquet on. Now what I want to do, and again, if you are not trained in doing this and your agency, if your EMS is not allowing you to do this, first I'll question why. If you're a civilian, we still recommend that you don't take tourniquets off once you put them on, because we don't know how well you're going to do this. However, in an extreme situation, this is why we're trying to teach you this. If you're out in the wilderness and you don't have the time with you and it's not on your side, then you should at least be aware of what we would do in this time. So now I'm going to take the strap off. Again, this is called a tourniquet conversion. And now I'm in essence taking this tourniquet off slowly and controlled. So I'm slowly opening it up. Okay. Now, the larger the mass that is being occluded, let's say it's a thigh, I would expect more changes to the patient's condition systemically, because if you're in the EMS system, this is where you would consider maybe looking at crush syndrome protocols, because you're going to be releasing a lot of that toxin out into the bloodstream. So maybe your agency does sodium bicarb, calcium, and so forth. But what's happening now is all these the toxins that were now being kind of stuck in this area distal to this tourniquet are going to be released. So that's the proteins and all the stuff that was being not used in this muscle, the muscle damage, right, as it's breaking down. So we've opened this up, and the goal is that we look at the fingers now and we get good cap refill. The circulation is coming back to the fingers, but we don't want to see any bleeding in this. If we monitor it, there's no more bleeding, we know that this tourniquet conversion worked. The QuikClot is working inside. I still leave the tourniquet on here, so if I do need to tighten it, I can go right back to tightening it. I'm not taking it completely off. So this again is called tourniquet conversion. Remember, you have 2 hours before any nerve damage takes place to an extremity when you put a tourniquet on. So we would do this just a little bit before the 2-hour mark. Unless we had a controlled setting, we can do it well before that. So appreciate you watching. If you have any questions, let us know. And as always, let's save lives together.